Hello everyone, welcome back to my channel Anytime Medicine, and today we are going to learn about G6PD deficiency. And in the end of the video we're gonna try to solve some questions that can be asked into the exam, and we're gonna answer it properly, that how it can be related to G6PD deficiency. So before we start, subscribe to my channel Anytime Medicine so you cannot miss my future videos that can be related to biochemistry and other stuffs too. So make sure you subscribe to my channel before you start this video. G6PD deficiency is the glucose 6-phosphate dehydrogenase deficiency that we have seen before in my previous video. So you make sure that you check out my previous video first and then come back here to understand this topic. So G6PD needed in the oxidative reaction of HMP shunt and NADPH required for normal red blood cell to function. So H2O2 generation triggered in RBCs because of the infection, drugs and fava beans, which is very harm for our RBCs and red blood RBCs and the blood. So NADPH is required to degrade H2O2, how that we are going to see in the next slide. In the absence of NADPH, that will lead to hemolysis of the RBCs. So here is the demonstration of G6PD enzyme. As you can see that G6PD is needed in a conversion of NADP plus into the NADPH process. So if we don't have this enzyme, it will impair the ability of erythrocyte to form NADPH and resulting into hemolysis. How that we can, if we don't have G6PD enzyme, it will not do two of this process, which is glutathione reductase process and glutathione peroxidase process, in which glutathione peroxidase process is converting H2O2 into the H2O molecule, because H2O2 is harm for our RBCs or the blood. From where this H2O2 come from? It is come from certain drugs, infection or fava beans that have to be degraded into the H2O2. So if we don't have G6PD enzyme, it will not degrade H2O2 into the H2O. That's why H2O2 work as an oxidant for our RBCs and it will hemolyze our RBC cells. G6PD deficiency is the X-linked disorder which mostly occurs in males, and this is most common enzyme disorder in humans, which has high prevalence in Africa, Asia and Mediterranean, and which may protect against malaria. This mechanism is unknown. Recurrent hemolysis of the RBCs may trigger the dark urine in the body. Because of the recurrent hemolysis of the RBC, it will present as a dark urine, and other HMP function usually are okay. In G6PD deficiency, there are two classical findings, which is Haynes body and Bite cell. Haynes body is oxidized hemoglobin precipitated in RBCs, in the corner of RBCs wherever, but it is precipitated in one place. And Bite cells are phagocytic removal of splenic. As you can see that first picture is for Haynes body, you can see the precipitated hemoglobin in the RBCs, and second structure is Bite cell, which is like someone bit into the RBC cells. Here is the microscopic presentation of the Haynes body and Bite cell. As you can see in the first picture that hemoglobin is precipitated into RBCs, which is Haynes body, and the second picture is the Bite cell, which look like that someone bit into the RBCs. Like we have seen in our previous slides, that some are the triggers that can cause the high amount of H2O2. One of those is infection, in which macrophage generates free radicals and which can lead to RBCs hemolysis. Fava beans contains oxidants that can damage RBCs, and some of the drugs like antibiotics, which is sulfa drugs, dapsone and nitrofurantoin, and one of it is the tuberculosis drug, which is INH, and some of our antimalarials like primaquine, quinidine and hydroxychloroquine that can cause the high amount of H2O2 in our body. And aspirin and acetaminophen is very rare for this to happen. For diagnosis of this disease, we have to use fluorescent spot test. In this disease, there is a defect generation of NADPH from NADP, so there will be positive test if the blood spot fails to fluorescence under the UV light. And there is only one treatment, which is avoidance of triggers, that can only treat this disease. So now we're gonna see some questions that are related to G6PD deficiency. So first question is, a 5-year-old boy is brought to the clinic because of the feeling fatigued for past 3 weeks. The patient has also had an acute onset of fever and chills about 3 hours ago. 1 month ago, the patient had his family travel to Asia and he received chloroquine prophylaxis prior to the trip. Physical examination is remarkable for pallor and splenomegaly. His hematocrit is 21%. Leukocyte count and platelet count is within normal range. Blood smear are conducted and show the presence of darkly staining regions within the red blood cells. So what is the most likely diagnosis in this patient? So the darkly staining regions within the red blood cell is Heinz body. So we can say that, and also his hematocrit level is 21%, so he is anemic. So we can say that chloroquine medication administration, anemia and Heinz body, which is lead to glucose 6 phosphate dehydrogenase deficiency, which is G6PD deficiency. That's how we can diagnose this patient that he has G6PD deficiency. So the second question is, a 30-year-old male is on his way to travel Africa to visit family and friends. He is given the appropriate vaccination and prophylactic medication prior to the trip. A week later, he presents to the emergency department with a jaundice, complaints of dark urine. Labs are collected and shown below: hemoglobin, reticulocyte, total bilirubin, direct bilirubin, lactate dehydrogenase and haptoglobin. A peripheral smear is conducted and stain. It reveals the presence of darkly staining regions within the patient's red blood cells. So what is the likely diagnosis of this patient? As we have seen before, that darkly staining regions in red blood cell is mostly Heinz body, and he went to Africa and he took prophylactic medication. And Africa is the malarial, like it has so many prevalence of malaria, so he has to be given uh, prophylaxis for malaria, so maybe the hydroxychloroquine or another drug for malaria. So malarial prophylaxis for Africa trip, dark urine, anemia and Heinz body in the blood will show that this person has to have G6PD deficiency. So thank you everyone for watching this video. If you like this video, hit the like button and make sure you subscribe to my channel so you cannot miss my future videos, and comment down below that what video you need in the future so I can work on that. Thank you everyone.